Hi, viewers. Hi, good evening, and how are you? From wherever you are, how are you doing? And how are you? I say good evening because it's already past 9 p.m. here from Ottawa, Canada. So, good evening. It's another day that I don't want it to end completely without me putting something in my channel. And my channel name is Nyabbs. Nyabbs. It's a pretty new channel. So kindly, as you watch, and thanks a lot for those who have been watching, as you watch and as you like and share, kindly also subscribe. Subscriptions are really going to push me forward because it's a new channel that I want to grow. So kindly welcome, like, share, and do not forget to subscribe. So once again, I'm back to you. Yeah, just to talk shortly, very short clip. Continuing on the subject of mental health, yeah, as I told you yesterday, the day before yesterday, yeah, about my training on mental health, yeah, I am a mental health specialist, trained in one of the branches. There are different branches of training in mental health. We have the counselors, we have the psychotherapists, we have the psychiatrists, there are different, and nowadays there are other branches coming up like medical psychotherapy. So we have all these branches, but my area is psychotherapy, and it is psychotherapy because my training is in marriage and family therapy, which is, as I want you to get it clear, it is uh, talk therapy uh, that we use as a healing method for our clients. Yeah. Uh, all the methods that are applied in each of these areas in the various fields in mental health. Yeah. The the issue that we want to tackle, all to bring around, is that the client receives healing at the end. And you know that healing has come at the end of dealing with a client when there is change all around the client. Yeah. So, what I wanted to make clear today is about psychotherapy. Yeah, psychotherapy is totally different from counseling. Counseling is not psychotherapy, and psychotherapy is not counseling. It's good for viewers to know that these are totally different areas, and this is different because mostly because of the training. Yeah. The training that, let's say, psychotherapists are given, the kind of skills they have been equipped with, and the kind of techniques that they use and the approaches, therefore, that they use in dealing with clients is very, very, very different. And also another area that comes in that brings a difference is in the approach itself, because the approaching of clients is systemic in nature. Yeah. For us marriage and family therapists, we are systemic in nature, and we are family oriented in nature. When I talk of being family oriented in nature, is because normally when you find someone going through an issue in a family, let's say we find someone is sick in a family, yeah, and maybe is sick and there is an issue of finances, or the person has to be taken care of. It is not only that person who is going through that problem. Yeah, you find that it is in the whole family. It will affect, if it's the mother, it affects the husband, because the husband has to continue taking care of this lady and also put in more finances, yeah, into maybe the medical care. And the children also sometimes, being children, they also do not receive the care they need. And sometimes it ends up that the children have somehow to help in some of the things that the mother had to do because she's unwell. Yeah, you find if it's a family and someone is going through addiction or somebody is going through is an addict to alcohol. Yeah, it does not just affect that person. Yeah, that person may not be functional at all. He may not even be able to functional like some. There are some people actually who really get affected. Like even sometimes they cannot handle their work. Yeah, they are not functional. Like they cannot take care of themselves. Their house is always dirty. They are not functional in their relationships with people. Yeah, they are not functional in being able to account for their finances and all that. You find that it does not just affect that person; it affects the whole family. Yeah, I mean, anything that any person is going through in a family, whether it's a kid not doing well in school, whether it's a kid who is being bullied, whether it is whichever problem, I can say, it affects the whole family. That's why our training, psychotherapy, focuses on the family. Yeah, it's also systemic, meaning that we do not just focus on that individual or just in the problem that that individual has come with. If somebody comes and they're going through a lot of stress, sometimes their body is fatigued, sometimes they can't sleep, sometimes they have headaches. Yeah. And then sometimes you'll ask them and they'll tell you, I do not know, but this is what I'm experiencing of late. We will look, at the habits of that person, their behaviors, whether they know well about sleep hygiene. Yeah, we look at what is happening in the family. It could be the whole problem is coming from the family. If it's a person who is working, we find maybe there's something going on at work. Yeah, it could even be coming from their peer group, the social group. Yeah, so we look at all that because it is always, as we say, when you take care of a problem in all areas, and also not just in that person, but tackle it from the source. Let's say if the source of this problem that this person has, let's say it's too much anxiety or even a depression that this person has, and the source of it is from the family, how the family maybe relates or interacts. Yeah, it is important to always tackle, where the source of this problem is. Yeah, that's why we do not just focus on the individual, we bring in the family. So as we deal with the individual, as we also give room for family to come in, yeah, just to help them. Yeah, if you're doing therapy for a child, obviously the parents have to be in. And once we look at it, yeah, from a family perspective and systemically from whichever angle it is coming from. So that is one big difference between psychotherapy and other areas of therapy, as I've mentioned before. And it is also good for family. It is also good for every person for all populations. Whether they are kids, whether they are adolescents, whether they are friends, new couples, people dating, couples married. All groups. If a group is going through something together, yeah, group therapy is really, really good for them. And we handle it from that perspective. So we give therapy, as I've just said. We also deal with a lot of psychoeducation. When I mean psychoeducation, is that sometimes people just need some education to be able to deal with situations where we find, like, let's say, an example of young parents or even old parents. Yeah, they could have come, and mostly it happens, yeah, that nobody taught them about parenting. Yeah, even now the parenting they received could have many negative, negative issues in there. And obviously, because that is what they know, they bring it forth to their own families. And even now, when they start getting their children, all that anxiety and the way they were brought up, whether it's in a negative manner, abusing each other, left, right, and center, emotional abuse, you find that it is still spilled over to this other young family. Yeah, so with we give psychoeducation a lot, especially to young parents. We give even to people who are dating when they're doing premarital counseling. This is a topic we do not forget to bring up. And when I talk about premarital counseling, people are planning to come together, to live together. Uh, it is good. They love one another from the beginning, but it is not easy because sometimes we have come from different cultures, and the way we have learned things is very, very different. And other ways that we have acquired our knowledge is not healthy behavior. So if we do not, unlearn these kind of things before we get together with this other person, it becomes hard uh, in life to deal with them, and then it takes toll in the relationship. So new people being friends, wanting to get married, or even people who are married, and after some time you find like you're stuck, you cannot communicate, something is happening, yeah, but you still love one another, you still want your family. Please, therapy is always there. There are people who are trained experts. As we know, in our area of psychotherapy, obviously we deal with all those kinds of traumas, yeah. Trauma, these are things that you go through that affected you highly until they bring you to a point where you feel like it's too much, I cannot handle it. We deal with all kinds of trauma, and everybody, anyone in life is exposed to trauma. It can be a child, it can be a young child of 1 year or 2 years or three. A child of any age can be exposed to trauma, hmm especially because of abuse. Most families really, some parents have a lot of emotional abuse from their mouths, you know, which becomes emotional, which becomes psychological, which spills to the child. So you find a child growing up and the kid is stressed. Yeah. Children can be abused sexually, children can be abused physically, or children can be neglected. So even a young kid can have a lot of stress. So, I mean, that is why there's therapy for children. Yeah. But normally, when the children come for therapy or when adolescents come for therapy, they actually have to come with their parents. Then we look around all that. So sometimes sometimes you might find the solution is just giving psychoeducation and also helping around on how the behavior can be changed, for people to adapt well. Yeah. So a lot of psychoeducation is required there. A lot of psychoeducation is required for people wanting to get married, young adults. Yeah, it's good for them to know on some of the things that they are really, really important about culture, about children, how to go about them, different kinds of the dynamics of marriage, yeah, commitment, caring. There are so many areas that these people, when they know them ahead in their young lives or marriage or before marriage, it really is a big milestone that they cover. Yeah, that they will not have to need to deal with them. The way people say, the first years of marriage, the first 5 years of marriage have a problem because you are learning one another. Instead of wasting all that time, taking 5 years or 7 years, trying to learn one another. Where is this person coming from? Why is he behaving like that? Always just spend a few finances and get therapy, you'll find that this, you might find when you come together, it will just be learning how are we doing these things together. It is not now learning where is this person coming from, because you have already prepared yourself. So there's a lot of psychoeducation required there. There's in marriages, there's a lot of psychoeducation. Yeah. In old people require therapy a lot because these are the most abused group I know. And normally they are the people who keep quiet about it. Yeah. I do not know what's happened to our society. Yeah, that they take they just think old people are weak. They are now not so important. Sometimes you find people who are very, very capable, or couples who are very, very capable financially, being abused even by their own children. Yeah, being told that they cannot make proper financial uh, mm, decisions. So all the decisions are taken, and sometimes they don't look at the needs of these old people. Yeah, you find old people, neglected. You find old people sometimes they have been brought carers who are paid to take care of them, and these carers can abuse them. They abuse them verbally. They abuse them. They can steal their things. They can abuse them by being careless, by not doing what they were brought there to do. I mean, I think sometimes it also happens in some centers where these people, they are put separate and they live there. But you find the people taking care of them because it's like a quiet agreement on the people taking care of them. I can just say bad behavior, bad interacting with people while you are being paid. Yeah, they mishandle these people, and these people normally, sometimes the old generation, they are not able to talk. Yeah, apart from a few, apart maybe from people like us who are in talk therapy, so we talk a lot, although sometimes we are told you're talking too much, but it's always good to talk. So they fear to talk. They'll fear even to tell anyone because they know if they tell someone and that person is being asked, it will become worse. So there are all sorts of trauma, mhm, that people go through. Yeah, trauma at work. Yeah, trauma. Look at the military people. These people who go to war, they're doing all types of hard work. They're dealing with people demonstrating all over, and then they see all types of casualties happening. Yeah, look at doctors. They go through, they see a lot. Yeah, so trauma is everywhere. Yeah, people are exposed to a lot of things, and that's why we say there's talk therapy that can help people. Also, in psychotherapy, we are trained in being behavior experts. Yeah. Uh, we do not read minds. People think psychologists read minds. We are psychologists, but we do not read minds. But we can read behavior, and we are experts in that area because we had a lot of skills. So that is why when people come to us with different types of behaviors, maybe people are involved in alcoholism or drug addiction, or you know or sexual infidelity, all this, all even stealing, all these kind of negative behaviors, because of the skills that psychotherapists have, they can be able to work with people with those areas to find out when these issues began and why they began and how they can be tackled. So there's nothing that cannot be dealt with in psychotherapy, and there's no person who cannot have therapy, because even for small children, sometimes we could just observe them, uh, or sometimes use some of the methods that we have been taught, and you are able even to help a child. Only that sometimes you find psychotherapists, because it's a wide area, so you will find that people refer to, you can know that, like me especially, I am so much attracted to family therapy, dealing with families, the issues in families. Yeah, the issues in those behaviors of addictions and all that in relational. You'll find that maybe I have taken more time even to do more research in that area. Yeah, and so that I've not done more research in the children area. Yeah, so you find people have preferences, but these people know each other, so sometimes they can refer you to get the best help with another person. Yeah, so The area of mental health, as I said, I don't know whether I defined it, because mental health is just a state of mental well-being, yeah, which we need, yeah. When I talk about mental well-being, I mean uh, mental well-being in emotions, psychologically, or even socially, that we are able to function well in those areas. When I talk of emotional well-being, like I mean, are we able to contain our emotions well? Are we able to express our emotions well? Are we able to control and, handle our emotions well? I mean, in a way that it is profitable to us. Are we able to act well and think well? That is psychologically. And socially, are we, do we have a good, healthy social interaction with people? Yeah. Because, of course, we know that we are social humans, animals, or humans. And it is always a strength, as I always said, when your social life is healthy, then it is a strength for you, even when you're going through issues, that you deal with them faster. So, mental health also deals with, as I've said, it is therapy, psychotherapy. We deal with psychoeducation. We are behavior experts. Yeah. So we deal with mental health in general, and mental health as I'm not talking about some of the symptoms or the signs that you can look at and say this person, is having issues. But there are all types of, symptoms that people struggle with. People struggle with their feelings. People struggle with lots of anxiety. People struggle with depression. People struggle even with sleep. People struggle with interactions and phobias, all that, yeah, which can need help. And also, we have another area of mental illness. So, but by the time we come to, I'm saying that therapy can keep you away from that, yeah. But mental illness, when by the time somebody tells you you have a mental illness, of course, that is something which has already been diagnosed, yeah. There's a highly, extremely, you know, escalated manner of behavior, yeah, in your behaviors, yeah. So it has to be have been diagnosed for someone to say that you have a mental illness, yeah. And also, most of these, we also have disorders. People who have few disorders, some disorders. Okay, some children are born. And they have those disorders because of a few things that happened. Some develop them, or they are made, uh, they are they are made worse by the kind of interactions in the families. Yeah, or maybe they didn't have it, but they develop it. Things like ADHD. I'm not saying that people cannot have it, but it can be escalated. Yeah, we have some of those disorders that make life functioning a bit difficult. So the carers of people with those mental disorders also really require a lot of therapy, because it's extremely hard when you have such kind of cases. So this is the area of mental health that we deal with, and mental health is very, very important to our general well-being, health in general. And it's good to know that this is a kind of treatment that people require. Not that they have to wait until it's so bad, but when you feel like, oh, I just need a break, I just need a break. My body is too fatigued. Sometimes I can't tell what is happening. You know, Sometimes when you need a break, actually, maybe you need a psychotherapist. Yeah. So, uh, so I'll be talking a little bit on some of these topics, not just to cause awareness, just to cause awareness, no therapy. But in case somebody would require therapy, then that one is something that is normally arranged, and after assessment we move on with the therapy. That's a bit different, which will be not done in this forum. Otherwise, keep watching. Keep watching. Today, this is what I had for you from this corner. And kindly subscribe, like, and share. This is Honey Nyabbs. And have a good night and a good day wherever you are.